I think we're all looking at what the Trump administration's impact will be on healthcare. And one of the things I keep saying is that in the absence of specific plans, there's an opportunity to influence, to have dialogue, to have a conversation. So for example, in the state of Texas, the State Health and Human Services Commissioner has asked for a 21-month extension of the 1115 waiver, which is about disrupting and changing, innovating, transforming healthcare delivery. And I think that's really exciting that we will hopefully get to continue that under this current administration. I think Medicaid reform is really important in ensuring that things like making sure that we have a mindfulness about the poor and the vulnerable and taking care of them, making sure that the markets don't get disrupted, the insurance markets don't get disrupted, and the fact that at the federal level there is a recognition and creation of a fund that takes into account sort of the, for example, $5.5 billion in cuts that hospitals have agreed to in Texas to ensure that they funded the Affordable Care Act. Well, maybe we ought to make sure that that gets captured and rebased in any kind of block grant or other state solutions. I think that's really important. And from a specific local level, we're looking at things, supporting things like, the fact that we have a need for 2,000 nurses in this community, and we need the authority of the legislature to allow for associate degree nurses to bachelor degree nurses programs in our community colleges that will allow us at least to have another additional 500 nurses here in this community, which would provide health care for our local community here. There's a reality check that when you try to change 20% of our U.S. economy, it can't happen overnight. And I think too that in the absence of specific plans, there's an opportunity, a true opportunity to have a dialogue about those things that we believe in, like providing access to healthcare for individuals, making sure that we are coordinating the care for disease management that allows us to manage costs and bend the cost curve for healthcare, and at the end of the day, making sure that we're treating every individual with dignity and respect. I think it's important for us to have that dialogue and for them to understand. And I think what you're seeing now is a realization from the new administration that there has to be a way to ensure that the president's objectives are being met, while at the same time ensuring that individuals are, what's the doctor's creed, first do no harm, and ensuring that they're having the impact they want with their principles. But I think there's an opportunity to influence.